How you doing? I'm Dan Decker. I'm a urologist. Work here at NARMC for last year or so, but been taking care of patients in this community for over a decade. I've been living in the northern Arkansas area for 13 years and have been practicing rural specialty urology that entire time, which I think is really relevant to what we're trying to do here, is to bring a surgical technology that most people have to go to cities for. You know, the CDC will say one of the biggest healthcare problems in the US is poor outcomes in rural communities. And almost all of that relates to lack of access to care. You know, for people that have a problem, if they know they're going to have to get in a car, drive 2 to 3 hours, make an appointment that they may have to wait 6 months for, you can see where the outcomes change. And so access is everything, and having the right tools. I think that was one of the things I learned early on in practicing in a rural community, is a lot of people just had the mindset that they had to go to a city to get good care. And it's really rewarding when you have these patients that realize that they were completely wrong there. You know, they over time they gain trust in you that you're going to take as good or better care than anywhere else, and you're going to have personalized care and know the patient. And that's something that's pretty rewarding as a provider. You know, sometimes patients don't understand why robotics, what does it add? Because, you know, I have to tell them sometimes it's just, you know, a camera in the belly, but why is that any different from conventional laparoscopy? When you're in the pelvis is a narrow area, and there's a lot of high real estate things around there that you don't want to damage. So robotics allows us to be very precise in a very tight area. You can go to a city and have minimally invasive surgery, but if you're coming back and you got a 2-hour drive, bringing robotic surgery to your doorstep really completes the process.
My name's Corey Smith. I'm an OBGYN. I've been practicing in this area for a little over 6 years. I love to practice rural medicine. I like seeing my patients and interacting with them and really getting to know their stories and just being able to help them attain the care that they deserve. I think what it really comes down to is options, local at home. So we want patients to be able to get the treatment that perhaps in the past they've had to go outside the community for, and that they can get that treatment here at this hospital. The Vinci essentially allows us to make small incisions and really to have 100% control of the instruments as the surgeon, and really, you know, magnify our vision, get 3D vision. It makes it a lot safer for the patient, makes their recovery time quicker. You know, the robot is really just an extension of our hands and our eyes, basically, and it gives us more maneuverability, more dexterity, and honestly, more options. Whereas we only have 2 hands, we can actually introduce sometimes up to 3 instruments into the patient. And we're able to toggle back and forth between those instruments. So it just gives us a lot of control. It also allows for decreased operative time, which does 2 things. Number one, it decreases the amount of time that the patient has to spend in the operating room, which is a benefit for the patient. And it also provides me the ability to do more surgeries in a smaller amount of time, which actually allows me to have less wait times for patients to actually have their surgery performed.
One of the beautiful and positive aspects of living in this part of the country is the rural and the isolation, and a lot of the patients like that. But one of the negative of that is there's some things that you need to get in city, and sometimes it's healthcare. But if we can do everything that they're doing there, but more personalized, just levels a playing field that it used to be, there'd just be a few places in the country that could get these outcomes that you want of curing the cancer plus maintaining quality of life. And we're excited to have that now at another rural community and keep patients from traveling 2 to 3 hours.
Here with us in this facility, you're going to get top-notch care. You know, we're focused on quality and good outcomes, and that's what we're going to be, you know, looking to achieve for our patients.